Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Madam President, distinguished delegates, ladies and gentlemen. The theme for this year's assembly, Health for Peace, Peace for Health, could not be more timely. As we slowly emerge from the pandemic, hopeful for better days, the world now finds itself in greater peril. War threatens humanity, both those directly affected by it and those staring at possible hunger unrelated to a conflict halfway across the world. Malaysia thanks the Director General for reminding us that the profound consequences of war on the health of human beings are happening not just where the news is focused on now, but in so many parts of the world where conflict is endemic, including in the occupied Palestinian territory where there is no end to the oppression against the Palestinian people. Economic disruption caused by the lack of peace will plunge billions into poverty. This will exacerbate socioeconomic determinants of health and derail our vision of health for all. Planetary health continues to worsen, and we now know more than ever the health of our planet is inextricably linked to health outcomes of human beings. Climate change has wreaked havoc on food supplies. The next zoonotic pandemic is no longer a hypothetical, but a near certainty. Neglected tropical diseases such as dengue that affects countries like mine are now a concern of other countries because of global warming. And yet there is hope. Malaysia supports recommendations for sustainable financing that will make the WHO fit for purpose. We support reforms towards an international health architecture that will avoid catastrophic moral failures in our response to COVID-19. However, any amendments to the international health regulations will have to respect the principles of equity, accountability, and transparency, and the sovereign process of member states. Yes, by all means, hold member states accountable in disclosing key information of public health concern. But let us also call for the disclosure of intellectual property and manufacturing know-how of vaccines, diagnostics, and therapeutics. Let us put mechanisms in place now for the fair and equitable distribution of resources needed in future pandemics. We should build back better, but equitably, with no country left behind. In Malay, we have a saying, berat sama dipikul, ringan sama dijinjing. We must not only share in the pain, but also share in the cure and the recovery. Finally, Madam President, Malaysia would like to call on all health ministers and officials here to be the voice of peace and social justice in your respective governments, to fight for universal health coverage for all our people. Let us honor the sacrifices of our healthcare workers during the pandemic by demanding resources needed to build resilient healthcare systems, for health to be seen as an investment and not just a budgetary line item, and for us to better look after the physical, the mental, and the spiritual well-being of our people and the health of our shared planet. Thank you very much.
Thank you.